I want to first of all speak to Professor Michael Keefe, who's a consultant ophthalmologist. Michael Keefe, good afternoon. You're welcome to the programme.
Good afternoon.
You are citing concern about upcoming closures of theatres in Temple Street Children's Hospital. What's happening, Michael?
What's happening is that they're proposing rolling closures, which would about cut maybe 1/3 of the operating number of operations done every day and every week. And if it goes on for every year, would involve 1/3 of the total number of surgeries being cut and not being done in Temple Street, which would have, in my view, a really bad effect on the management and children, and it would be very serious.
But what kind of surgeries are we talking about here now? Were these elective surgeries, emergency surgeries?
Well, these would be so-called elective surgeries, but elective surgeries, many of them are quasi-emergency surgeries, as I've stated before. Some of these are staged operations. They're not emergency as such, like someone who has to be rushed to the operating room ASAP or within an hour or two. These are people who need surgery maybe next week, the following week. Some of the surgeries are ongoing, as in my own case, where I'm treating tumours of the eye in childhood, where these surgeries are staged, or in terms of glaucoma or cataracts in children, or various very severe eye problems. And I'm sure the same applies to other people who do spinal surgery and neurosurgery and even general surgery. The same thing applies. The same principles apply. That it's so-called elective, but it's surgery that has to be done at a certain time.
When you talk about your own specialist area, which is eye surgery, and you talk about dealing with things like tumours of the eye, if I was a parent of a child who needed that surgery, I'd want it done as soon as physically possible. But are you going to have to turn around to some parents now and try and make a calculated judgment on who needs the surgery first?
Well, that could happen. That's why I've raised the issues, because I don't want that situation to develop, and that's exactly what could happen. One will have to compromise time and when to do it, and that's what we want to avoid. And that's precisely what could happen if what's proposed goes ahead.
Why are they telling you that you're going to have to reduce the number of surgeries by up to 1/3 a day?
Well, it's all very, very, as I said before, very, very confusing. On the one hand, you have a hospital which is quite efficient, where the system works well. And they're being told by the HSC that they're doing too much work, that their amount of work this year is more than last year, and that the HSC is not going to give them the funds to go on doing this. And the hospital are saying, well, our budget is going to run out. Then on the other hand, you have a letter from the Department of Health, which was dated the 8th of February, telling the hospital that any patients waiting over 20 weeks, that if they're not done, surgery not done on them, the hospital will be fined $25,000 per month per patient whilst they're on the waiting list. So you have on the one hand the Department of Health telling them that people on waiting list more than 5 months, unless they get surgery done, the hospital will be fined. Can you imagine $25,000 per patient per month? And then on the other hand, you have the HSC saying they're doing too much work and they're going over their budget.
That's no carrot and all stick, the way you're reading it out there. But let me just clarify this now, because this is where I find the Irish Health Service falls down dramatically. They cut the budget because the hospital was treating too many sick children. I'm only guessing that there are no such thing as too many sick children. You still have waiting lists. You still have children that need to be seen sooner rather than later. So, in other words, the hospital was doing the right thing by treating as many patients as possible, yet now they're being penalised.
Exactly. You get penalised for being efficient and effective. And they talk about, these budgets. I mean, of course, we all live in the real world, you and I and all of us. We know what's going on out there, and we know budgets because we have to do it in our own personal life. But by and large, this is a hospital that's extremely efficient and effective. You can control the amount of work coming in. Last year I treated 8 tumours of the eye in children. The year before that probably was 6. This year might be 10. So you can work within those narrow confines. It's just not possible. And basically what they're saying is, if you're too efficient, too effective, if you're doing too much work, we're going to penalise you.
That's not what you signed up to medicine for, is it?
No, not at all. Not at all. That's why I suppose people like myself put my head above the parapet and say, enough is enough. We're going to highlight this. Because what happens in effect when this is done is that the hospital, the management walk away from it, and they leave it to people like me to tell the parents. They leave it people like me to take the responsibility, and they walk away from it. And it's none of their business then. Oh, they've done their job. And the problem as well is that we've hospitals where managers won't speak up. They won't come up front and tell it as it is.
Why do you think that is?
I have no idea. They seem to get intimidated. They seem to get intimidated by middle management in the HSC and the Department of Health. Probably the phone call comes. And even people like me, I'm too long around not to be intimidated. But there are probably consultants who won't speak up for their patients, who are afraid for a number of reasons. I don't know why, but that is the reality. It's happening at the present time.
We're getting the views of Professor Michael O'Keefe, who's a consultant ophthalmologist at Temple Street Children's Hospital here on Newstalk Lunchtime. Michael, if you do have to turn around to a parent and tell them that their son or their daughter can't have a certain treatment, what would be your long-term fears of delaying treatments? Because I suppose that there's no way of accurately predicting, but you'd have a good idea what's going to happen.
Oh, yeah, well, I've been at it a while. I mean, if you turn around to a parent and a child has, they say, cataracts in children, and young children are quite different to adult cataracts. If you have to delay these, you'd have to tell them that the prognosis for getting good vision is less, that they won't do as well. If you've got glaucoma, they could go blind. If you have a tumour and you can't treat it, if it goes outside the eye, it'll kill the child. It's as simple as that. It'll kill the child no matter what you do.
And if you have you had to tell parents something like that yet, or is this something you fear?
And that's why that's why I decided that there's time that someone has to speak up and prevent this from happening.
All of this debate is happening around the time of the Children's Hospital discussion that, they're trying to build a big children's hospital around the corner from Temple Street, not a million miles away. But we've had a debate about that we need it now. And you're telling me at the moment that the theatres that we have, the existing theatres that could be in operation, are being cut by a third. So what do you make of all the conversation, all the political brouhaha that's gone on about the Children's Hospital when you're there at the coalface?
It's academic because we can't even get the basics right. We can't even do what we're doing at the moment. And then all this talk about world-class centres and centres of excellence, this is all pie-in-the-sky stuff at the moment because we can't even get the basics. We can't even do what we're able to do at the moment. We don't even have the money to run the basic system at the moment. Or if we do, maybe the money is being spent poorly. I'm not in affair with the budget that Temple Street, how they spend it. But all I can do is highlight what I do myself and fight for the patients I treat.
We've been discussing not only the Children's Hospital but the issue of children on trolleys, and the point that I was making the day that we were discussing that was that has to be a line in the sand. Whatever about adult trolleys becoming the norm, whatever about people on trolleys on wards becoming the norm, we have to call a halt when we see children in children's hospitals on trolleys. We have to defend and stand up for children here. You're one of those that is doing that, but do you feel that ultimately you're facing a bureaucratic battle that a good doctor like yourself simply cannot win?
Well, you are. I mean, you get worn down because I don't have the time to keep. I have to do other things. I don't have the time to keep fighting it, and less of people get intimidated. The phone call comes through, or I'm sure I'll get a letter tomorrow, the day after, threatening me that I'm bringing the hospital in disrepute. And that I could be suspended or reported to the medical council, or I could be fired. But that's me. I've been in medicine for many years. As I said before, I'm at the other end of the scale. I'm not a young consultant, and nothing like that intimidates me. In fact, it makes me determined to make it to even go harder and to highlight it more so, and to really fight them.
OK, let us know if they send you that letter. Professor Michael O'Keefe, Consultant Ophthalmologist at Temple Street Children's Hospital. Hopefully you'll never have to tell the parent what you fear you will. Thanks for talking to us, Michael.
Thanks indeed. Bye. 53106
is the number for your messages. How frustrating and angry is that? We had Susan's story on the programme last week in which we were talking about a simple thing like glue ear. Her daughter having long-term hearing problems because it simply wasn't treated in time, and she fell off the National Treatment Purchase Fund list and so on. Again, you have Professor Michael O'Keefe there, one of the leading consultants in ophthalmology in the country, afraid he's going to have to turn around to a parent someday and say that we can't operate on that tumour right now, and knowing that that might be a tumour that could ultimately prove to be fatal. Something's going to have to be done about that. We'll try and get an answer from Temple Street Children's Hospital and the HSC on that. Lots still to come here on Newstalk Lunchtime. We'll be crossing over